whenever he wakes up.
Watch out for his teeth. He looks like a meat eater.
Any friends or family on their way in?
Yeah. That's him over there.
Big family.
The body is that of a well-nourished, too well-developed female, 31 years old, measuring 168 centimeters in length. Body is cold with moderate rigor.
Holly?
Trevor, I haven't seen you for ages. Did you ever get married again?
No. Can't afford it.
I'll bet. Is this your case?
No, I came to see you.
Oh, well, if you came to see me... See me!
You haven't changed a bit. Still crazy after all these years.
Thank you. I love you, too.
Look, I got a problem. Dr. Daywright had to go east, and Espar has hepatitis, and I don't have anybody to teach pathology.
I am standing here panting with lust, and you're worried about a pathologist?
Can I talk you into moonlighting a couple of weeks?
Gee, I've got my cases here.
No, bring them over to Memorial. I'm sure our interns and residents will be ecstatic to learn a little forensics.
Yeah, I don't know, Trapper. This is, home. I've got my eccentricities.
Oh, no, it'll be your lab till Daywright gets back. I mean, you can run it any way you want. I'm not gonna interfere.
Well, I guess there's a chance if I were over there that you and I could,
Well, of course, we'll keep all options open.
Okay.
Okay?
Sure, I'll just, bring my work with me.
You're a sweetheart.
I know.
See you Monday morning.
My pleasure.
Oh, yes.
I should have seen that. The skin texture is smooth. The hair is red and a handsome female distribution. The eyes are brown. The lips are full and cherry red. And the body is hot.
I've got you under my skin. I've got you deep in the heart of me. So deep in my heart, you're really...
How's it coming?
Great. I've been through adenomas, anthrax, and amoebas, and I haven't even got through the A's yet.
Took a long time to collect those teaching slides.
I bet.
Let me know when you get up to the zosters and zygotes.
Sure.
I said,
Can I ask you something?
Uh-huh.
Don't you miss seeing real patients?
I see patients every day.
You see pieces of them.
Sometimes they're whole. Sometimes they're in pieces.
Oh, don't you miss clinical medicine? Investigating an illness, the hands-on cure?
JT, did you ever hear that story about the blind men feeling an elephant?
Wait, one felt the leg and thought it was a tree. The other one felt the tail and thought it was a snake. That one?
That's the one.
No, I haven't heard it.
Most doctors work blind, too, you know? Using gimmicks to try and see what makes an organ sick. X-rays, blood tests, biopsies. We're the only ones that get to examine an organ in hand and up close. That's why I like being a pathologist. We're the only doctors who don't work blind. For instance, I can tell you a lot about our Jonah here. This is a man's hand.
How do you know that?
Chromosome analysis. No bar bodies. He was about 50 years old, más o menos 5 years.
Wait, how do you know that?
X-ray, bone structure, arthritic changes. This is a right hand. He was right-handed. Increased dermal thickness on the distal aspect of the third finger, where a writing pen caused a callus.
Wow. What else?
Well, he discoed.
Hey, Dr. Pagano.
Pagano.
Whatever. Hey, look, we're friends of Wiley, the guy you flew in yesterday. Your nurse is real tight-lipped about how he's doing. Says we got to talk to his doctor, which is you.
Yeah, well, I got to talk to his family first, and I'm still trying to find him.
We are his family. Ain't nobody else coming.
All right. He's very weak. He's got a high fever. He lapses in and out of consciousness. I've looked at his lungs, his blood, his urine. I've tested him for energy.
And no energy?
Energy. His immune response. So far, I got no idea why he's critical. I mean, what the hell happened to him?
They ran into the Montes.
That's the East Bay gang, a bunch of warthogs and rednecks.
Yeah, he said he got in a fight, but, you know, a couple of bruises aren't his problem here. I mean, maybe you guys can tell me. Has he been sick? Does he take medicines? Street drugs?
No, nothing like that.
Any prior illnesses?
No.
I noticed he had some sores on his arms.
I got him, too. I mean, you sleep outside, the bugs eat you for dinner.
Well, Wiley's a rock. We've ridden many a long highway together, Doc. He ain't never been sick except now.
Okay. So, wait. Why did this other gang go after him in the first place?
Who knows? An old grudge, a woman. It don't matter. We're gonna get even.
Do me a favor. Don't. Come on, man. I need that ventilator more than you need the cash. Look, how can I pay all of it to you in 1 week? 3 weeks? 2. Look, man, you know, you gotta work on your compassion, you know? Yeah, I'll work it out. Thanks for nothing. Hi, Jan. I'll take her back. Thanks.
You wanted to show me something?
Yeah. Right here is the best view. You see this? That is what's causing your fainting spells, your shortness of breath. It's called a myxoma. It's a tumor on the heart.
Tumor? How can that just show up suddenly like that?
Well, you've had it for years. It's just gotten big enough now to give you problems. And it's going to have to be removed.
You mean heart surgery? Aren't there any medicines?
You want reassurance or you want the truth?
Oh, a little bit of both, I guess.
Okay. The treatment is surgery. The prognosis is good. We'll get Dr. McIntyre to take your case.
And he's fixed a lot of these mixed omers?
Myxoma. Yeah. He's fixed them before. It's not a common tumor, but Dr. McIntyre isn't a common surgeon. We diagnosed it early. I think you're going to do real well.
I'd like to call my family. I think I should let them know what's going on.
Well, take care. See ya. See you next week. Nathan!
Yeah.
The unit tried to reach you 3 times last night for Mrs. Chandler. Your post-op colectomy was a failure.
Oh, yeah? Well, I've just seen her and she's fine.
Well, she's fine because I stayed up all night taking care of her.
Thank you. You'll have to excuse me. I have a case at St. Joe's in 15 minutes.
Whoa. Now, wait a second. Now, this isn't the first time this has happened. It is not my job to take care of your overload. If you can't follow up on your patients, I don't think you should operate on them.
Jackson, I've been a surgeon since before they lowered the standards to allow you into medical school.
Oh,
don't tell me how to practice medicine.
Make a confident incision. When they're dead, JT, you don't have to worry about being gentle. Also, you don't have to worry about leaving scars. Good. I'd like you to be done by the time my nails are dry.
I must say, you are looking especially ravishing tonight.
Oh, thank you, thank you. I've got a dinner date.
Wasn't this lady just operated on a month ago?
Uh-huh.
Well, if she had an aortic aneurysm that was going to rupture like this, shouldn't the surgeon have noticed?
Should have.
Well, maybe she died because the surgeon didn't do it.